This week, Patty Callahan from the Central Ohio Area Agency on Aging presents on this resource for older adults and caregivers.
Well, thank you for inviting me tonight. I'm just going to, tonight, really my goal in the time we have is just to kind of explain a little bit about what area agencies on aging are and what we do, and some of the services that are out there for people typically 60 and older, or people who are living with some sort of disabling condition. Let me explain a little bit about my role. I manage a program for family caregivers. It's been around since 2001. And this I manage came about through the Older Americans Act 20 years ago. And I started when this program came into being. And it was the first time we ever had any funding in the United States to provide help to family caregivers. And it's not a ton of funding. The idea is to get some information out to caregivers who are just beginning maybe to reach out to learn what might be available to them in the way of help, and perhaps address some respite care needs, or just some very practical, concrete needs, maybe a piece of medical equipment, a piece of furniture, incontinence supplies, what have you. The program initially, it has provided for assistance to caregivers who are caring for someone 60 or older, caregivers who are caring for someone of any age who has some type of dementia, and then caregivers for children under the age of 18. That's our kinship caregivers, of course, and that's why I'm here tonight. And then also for caregivers, caregivers that are caring for someone who is disabled, and perhaps they are the parent or the grandparent, but this is an adult individual who is disabled, and the caregiver is 55 and older. Likewise, for the kinship assistance, the caregiver needs to be age 55 or older. So again, this provides for information on programs and services and all sorts of all of the options in terms of long-term care. And we talk about how care is paid for, whether it's a government-funded program or whether it is going to be something that's going to be covered privately through someone's own resources. So we know that for you who are caring for children, there is some assistance through this program, and every area agency on aging, all over 600 of us in the United States, receive this funding. It comes from the federal level down through the state level to the area agencies on aging. And I'll explain a little bit more about our network here in a minute. But that funding, as I mentioned, it isn't something that's an ongoing solution. It's kind of stopgap help for any caregiver caring for anyone of any age. But we hope to get you linked with whatever help you might need going forward. We know that, for many people who are caring for children, they may have some needs of their own for some services, as well as they may be also, facing caring for someone, an older family member. And so we talk a lot about helping, caregivers plan for care as well. So we're going to touch on that a little bit here in a minute. Our services, we are not going to be the experts on children's services. We're more the experts on services for older adults and people who are living with some sort of disabling condition. But we can get you started finding help. We're navigators. So I'm just going to briefly talk a little bit about what kind of brought this caregiver program into being, and that certainly is that we know folks are living longer. And actually the fastest growing segment of our population is people 85 and older. And so we have 1 in 4 families providing care to an older adult. And we know that they're facing many challenges. And particularly in the last year or so. That's only been magnified with the pandemic. And what we also know is that many family caregivers are providing care to a loved one, and they have no outside assistance whatsoever, no formal services, and no informal supports through family, friends, or neighbors. And many times they don't really even identify themselves as a caregiver. So outreach is sometimes challenging to let folks know what kind of help is available. All right. So we talk a lot about having a conversation around what care someone might want as their abilities change. And I'm not going to dwell on that so much tonight, but planning is key for yourself, for an older loved one. We just want to let you know we're here to help you do that, and to provide whatever guidance, information, resources, linkage that you might need. When you are planning, this is something that, isn't just a one-time event. We always start where our life is currently in terms of our health and our resources and what's important to us. And we kind of go from there and laying out a plan for ourselves as, again, we may need some additional help with some of our, what we call activities of daily living. But it is not just something that you do and then it's done forever, because life changes, our wishes change, obviously our health and our abilities change. And so we need to keep revisiting this plan, and we need to be communicating our plans to our loved ones so that they know what our wishes are and our resources are used to best advantage in making those wishes concrete and making them happen. So we know that sometimes starting out a conversation about this type of planning with an older loved one can be a challenge, and we're more than happy to guide you through that and even give you the words to kind of get a conversation off the ground. We have a lot of materials on our website that you're welcome to print off, or we can send you hard copies of these in the mail. If you just want to, again, just hand someone some information to look over and kind of open the door to the conversation that way. And we know that family meetings sometimes can be challenging when you're thinking about long-term care options and what someone may need in the way of help. And so we can guide you through that process as well. We give you some pointers here. And you're going to also receive an electronic copy that the handout that goes along with this PowerPoint that gives you more detail on some of these points here. But just the main, I think the main thing is to ask questions of whoever the person is that may be needing care, rather than kind of starting with, what they're not able to do, but ask them what's important to them as things change for them. And that's, I think, very key. Keep it positive and keep it on track. Bring somebody in, whether it's a formal mediator or somebody that's just good at that within the family, to help hold that meeting.
And Patty, you're meaning like planning ahead for caring for like an older loved one, right?
Older loved one, yes, absolutely. That's where our focus is.
And we've actually never talked about this topic at all, and I'm sure many of you have older adults in your family who you could be thinking about this for. I know my parents recently went through it and probably will again. So this is like a really helpful topic to think about, but also you can start thinking about it for yourself too.
Yeah. So. Anybody of any age really needs to kind of put a little time into thinking about this. We're all mortal. We all, can get sick or injured, and depending on what our homes look like in terms of accessibility, things can change in a heartbeat. So just having some idea of what's out there in the way of help I think is important for all of us. And, in terms of just even planning for designing our home and setting that up so that if we want to stay there, for the rest of our lives and age in place, we can do that and make it easy, but set it up so that it's easier to live there. So I'm just going to backtrack a little bit now and give you a little bit of information on the area agencies on aging. I know you're from all over the state, and there are 12 of us in Ohio. We all serve multiple county service areas, and we're starting points. You may also hear us referred to as an Aging and Disability Resource Center or an Aging and Disability Resource Network. And we have huge databases of resources for older adults and are beginning to amass resources for kinship caregivers too, although again, there are other organizations that are more the expert on that than we are, but we certainly can get you started on what's available in our service areas. And our service area here at the Central Ohio Area Agency on Aging is Delaware, Fairfield, Fayette, Franklin, Licking, Madison, Pickaway, and Union counties. And we're responsible for administering all the programs that are funded under the Older Americans Act in that service area. We're responsible for taking stock of what services and what programs are out there in our counties. We're responsible for kind of developing programs and services to serve the needs of older adults. And so every 4 years, we do a massive needs assessment and then develop an area plan to address the needs that we find. So that's how Ohio is divided up. And so we're area 6 there in the middle. And then you can see all the others there.
Oh, we just have something in the chat. I don't think you'd be able to see it, but it asked, would you please list the 3 A's again?
Area Agency on Aging.
Thank you.
Mm-hmm.
Has to be a little trouble.
Okay, you can go ahead now.
So we fund community-based services, and those are going to be things that you might be familiar with, like transportation programs, home-delivered meals, personal care aides, homemakers. That funding primarily comes through the Older Americans Act, with the same legislation that set up the area agencies on aging many years ago. We all provide information and assistance and education on a wide range of aging issues. And we all provide some evidence-based health and wellness education. That's part of what we do too. And that's provided for under the Older Americans Act. And we advocate both at the local level, the state level, and the federal level for older adults and their families and individuals who are living with a disability. So we do quite a bit of advocacy and in terms of policy that will benefit older adults and their families. And in Ohio, we administer Medicaid waiver programs that I'll talk about here in a minute in a little more depth. And the waiver programs, this is a type of Medicaid, but it's different than the Medicaid just for healthcare. Think of this as long-term care Medicaid. And the waiver programs are intended to allow someone to continue to live at home who would otherwise need care in a nursing facility. And so what connects kind of all of the area agencies on aging in the United States is this elder care locator. And we can help you find any of the other area agencies on aging too. Happy to do that. And I talk to people from all over the country who have loved ones back here, maybe in Ohio. But that phone number is the Elder Care Locator. It's operated by the National Center, National Area Association of Area Agencies on Aging. All the area agencies on aging in Ohio provide a free long-term care assessment. And that's just an informational session to get someone up to speed on what long-term care services are available. And then we have all sorts of resource guides that we produce through COAAA produces the older adults guide, which is more like a phone book of aging services in our area. And then we also produce a whole series of topical guides on everything from, well, one of our newest guides is a kinship care guide.
Mhm.
That's on our website. All of these are. We have guides that address the services that perhaps someone might need if they're going to be paying privately for help. That's our private pay guide. But then we have some guides that are more specific to practical needs like utility assistance programs and prescription assistance programs, housing. That's going to be for our 8 county service area. But most area agencies on aging will produce some form of those guides in some respect. They may just do it all with the one big guide. We just decided we wanted to be able to go into more detail so people understood what we were directing them to a little better. Okay, and those are the guides. That's what they look like. We kind of branded them, and those are all on our website. You just go to coaaa.org, and then at the top, under resources, you'll see guides and publications, and they're all under there.
I'll send out the links in an email after the meeting if anyone wants.
Great. Thank you, Angela. And then the caregiver toolbox book that's pretty big to try to download. You can kind of page through it on the website, but that has handouts from 8 workshops that we developed at COAAA for family caregivers that cover everything from in more depth on planning, navigating the healthcare maze, caring for someone in a care facility, caring for someone at home, and the nuts and bolts of choosing care providers, and then preventing burnout for the caregiver, caring for a difficult family member, and managing family dynamics around caregiving. That's a very in-depth guide, and we're happy to mail out copies of that if you just want to give us a call. Happy to do that. And there's our website, and then aging.ohio.gov is the Ohio Department of Aging. All the area agencies in Ohio are underneath the area agency, under the State Department of Aging, sorry. They have on their site, they do have a place where you can, that long-term care housing guide where you can look for care facilities and get a little bit of quality information on those. And then that site there, proseniors.org, I really like to let people know. In Ohio, that is our hotline a legal hotline for seniors. And that hotline is staffed by volunteer attorneys. And they field questions on just about any kind of legal issue that might come up. They don't take on cases other than in the Cincinnati area because they're based in Cincinnati, and I believe they do take on some actual cases there. But they will get you referred out to legal aids and that sort of thing if you need actual legal work done. They have some wonderful handouts on their website. Their fact sheets are just tremendous. Can walk you through everything from tenants' rights to Medicaid. And they will give you a free half-hour consult if it's not really a question that can be answered quickly. If there needs to be more of a discussion, so they will then prearrange a time to call you back so that they can talk in a little more depth about your situation.
That sounds.
And then yeah, they are a phenomenal organization. I probably refer there almost daily because there's something that someone needs more in-depth legal advice on. Disability Rights Ohio is an advocacy organization. They also have attorneys on staff that can interpret the Americans with Disabilities Act and help people understand what accommodations that should be made for them in various settings. And help them understand, what their rights really are, and perhaps, jump in then and advocate for them where needed. So I've talked a bit about, I kind of glancingly referred to services here, and what we're talking about here are services that can come into the home or are based in the community or facilities that, again, can help someone continue to live as independently as possible. And there are many ways to access these services. There are government-funded programs that help with the cost. We, at the Area Agencies on Aging, again, those Medicaid waivers, we do the case management for some of those programs. And so that's one way. And then you can also pay privately for these services if the resources are there to do that. Somebody have a question? No? Okay. So these are the services that I've been referring to. These, again, some of them, there are many ways these are funded. Some of these services are provided on a sliding fee scale basis because they are covered under the Older Americans Act. Some of these services are funded under county levy programs. Ohio is unique in that we tend to fund some of our senior services under property tax levies or sales tax levies in some of our counties. And those are typically going to operate on a sliding fee scale based on income and assets. And all of these programs, and then, well, and actually under this listing here, I notice we've got nurses in there. The nurses and the therapists are typically going to be covered under a Medicare if someone is 65 or older, or insurance. That's not something generally that these home care programs will provide other than the waiver programs. The levy programs absolutely will not be providing nurses and therapists. There are different kinds of home health aides. There are really three. There is an aide that can come into the home to provide personal care. And that can be, bathing, dressing, feeding someone, grooming, that sort of thing. There are aides that are really coming to be more of someone in the home to provide companionship or supervision to someone who really isn't safe alone. Maybe remind them to take medications, set out a meal, help them, perhaps in and out of the bathroom. And then there are homemakers that come to do some light housekeeping. And so that is, things like laundry and sometimes grocery shopping or preparing a meal. And so those are the three kind of aids that typically are available through what we call home health agencies. The difference, there are two different kinds of home health agencies. There are those that do have nurses and therapists that go to the home when someone has just gone home from a hospital or from a rehab center. But then there are also what we call non-medical agencies that provide more of the non-medical services, including even being able to drive someone to a medical appointment if needed. And those are typically going to be private pay. I'm not going to go through all of these. Just know that they are the adult day health centers right now, I will say, are not up and running because of the pandemic. But typically when they are, that is a center out in the community where someone can go for part of a day or a whole day and receive supervision, have their noon meal, they have activities. And that is a form of respite for a caregiver caring for a loved one. And in some cases allows a caregiver to continue to work because when they are open, they are typically open normal business hours. So I just point that out because a lot of people are not familiar with that service. And we're hoping that we'll get to the point where they are open again. But and I think in a few spotty areas in Ohio, they might have opened, but for the most part, I think they started to open and they closed back down. So,
would the respite care piece apply to kinship caregivers at all?
Angela, it does. Respite does apply to kinship caregivers. The challenge for us in actually being able to provide that particular service under the program has been finding the providers. So there is a category of services under this caregiver program that really we have accessed more for kinship caregivers than respite, and that's what we call supplemental services. And that category of services is fairly broad. Again, we can do some emergency assistance with a utility bill or rent in some counties. Each of our counties handles it a little bit differently. And I should say that our program at COAAA is very different than the other area agencies on aging because we have an access point in each of our counties. We have a partner agency that is where a caregiver can call and access the assistance right there in their counties. And based on the fact that each county has its own different set of community resources, they kind of know better where to refer someone in a given situation. But for example, we have helped through the program with some things like furniture. If a caregiver is taken on, a child and needs a bed, that kind of thing. We can help out with kind of a mix. I would say some of the emergency assistance, the one-time emergency financial assistance, or some of the concrete needs, maybe medical equipment, even that kind of thing we have done. Respite, at this time, I would say is a bit of a challenge for all of our partners simply because they just can't find the providers. So.
And then one more question in the chat too. Does the passport program still exist?
Well, it sure does, and that is one of the Medicaid waiver programs. Yep. I think I just talked about the levy programs here, so I'm not going to belabor that one, but I'll get over here and talk about I'm going to skip over a little bit here. So we know Medicare generally funds healthcare only. It isn't a payer source for long-term care. Medicaid is what generally pays for long-term care when someone's resources have been reduced down and resources are very, very limited. And it funds that long-term care both in facilities, but then through these waiver programs such as Passport in the community. All the area agencies on aging in Ohio we do the care management for Passport. It is a statewide program for people age 60 and older. And it does provide a whole range of the services that we just saw on the other slide. Home delivered meals, personal care aids, homemaker aids, and emergency response units, the medical alert buttons, and care management or case management. That will be someone who is overseeing the whole care plan that's making arrangements for the service. That first of all is doing an assessment to determine what the needs are, and then making arrangements for the services to address those needs to come into the home. And then they're the go-to person. And so we do the case management for Passport at the Area Agency on Aging. And we are also now doing some of the care management for the other waiver for people under age 60, and that's the Ohio Home Care Waiver. And then we also do the case management for the assisted living waiver. Ohio does have some Medicaid for assisted living, although it's somewhat limited. Not every assisted living facility in Ohio accepts Medicaid, and many that do require someone to pay privately for 1 to 2 years before they will accept Medicaid as the payer. So that does limit, the number of slots available to individuals for assisted living. But it is considered a less restrictive environment, and so it is another way that someone can receive care and not necessarily have to go to a nursing facility. And then My Care Ohio is for individuals who are eligible for both Medicare and Medicaid. And My Care Ohio isn't just waiver. My Care Ohio combines case management and the management of benefits under Medicare and Medicaid for individuals. And each area of Ohio has managed care companies that have contracted to manage those benefits for people who are considered to be dually eligible. So it gets a little confusing, but there can be people who don't need long-term care enrolled in My Care. And then there are people in My Care that do need long-term care that may be receiving waiver services. And then there are waivers in Ohio in every county for individuals who have developmental disabilities. Your starting point there would be through your county developmental disabilities organization. So the program that I was just talking about is the National Family Caregiver Support Program. And that funds a lot of the work that we do in terms of information and assistance. Normally, part of my role is to be on the phones, providing consultation to family caregivers around their situations, and then helping them get linked with help if that's where we're at, or if they need to take some information and talk it over with family, or if we need to, do a conference call to try to bring everybody in and so that everybody kind of hears the same thing at the same time. The program typically can pay for counseling for family caregivers. In our service area, we in some of our counties, it's set up so that can even be therapeutic counseling if needed, not just counseling around long-term care options. And then the respite services, the program can cover for older adults. Respite in terms of in-home respite, and that would be under maybe bringing a personal care aide in or a homemaker in, and allowing the caregiver to step out maybe while they're there. Normally, when we're not in the midst of a pandemic, the respite can be in-home, it can be adult daycare, or it can be in a care facility. Of course, right now, care facility isn't necessarily a thought that any of us are, thinking about so much. In terms of, not being able to actually visit and kind of monitor a loved one's care. That's been a real challenge for sure during the pandemic. But there are times when the caregiver may need their own procedure or medical treatment and just may be incapacitated, and that is necessary. So it's something that we can certainly look at if the need is there. And I talked about the supplemental services earlier. I always encourage people, if there's a need, if in doubt, reach out and we'll take a look at it. If it's not something our program can do, we'll try to find another way to meet that need. Okay. So those are our county partners there in each of our 8 counties for the caregiver program. They're also focal points in their counties. In some cases, they are the program that provides those levy-funded services for older adults in their county. So they're going to be a good starting point in each of those counties just for information on what is available at the county level. So you can go directly to them for information and help. You don't have to come through us at the Area Agency on Aging, but we're more than happy to, talk with you about the services and help you get linked with those services if needed. So
Good.
I always say, don't struggle, reach out for help.